So vomiting is a very common symptom. There are many causes that can cause vomiting in children. And the most common cause of vomiting in children is actually gastroenteritis, which is an infection of the gut and usually is caused by either virus or bacteria. And sometimes it can also cause diarrhea. The symptoms is usually very mild and usually is self-limiting, and the children usually recovered after a few days. However, persistent vomiting sometimes can cause dehydration. Sometimes can be also a sign of a more serious infection, such as brain infection. So other than the gastroenteritis, there are many other causes that can also cause vomiting in children, such as food allergy, and the symptoms may include itchy body rash, swelling of the eyes or the lips or the tongue. Sometimes they can also cause breathlessness. There are many other infections that can also cause vomiting in children, such as urinary tract infection, medial ear infection, lung infection, as well as brain infection. So you need to consult your doctor immediately if your child has vomiting and has additional symptoms such as high fever, irritability, severe headache, earache, chest pain and breathlessness. Appendicitis can also cause vomiting in children. Appendicitis is a painful swelling of the appendix, and the symptoms may include fever, vomiting, and progressive tummy pain which worsen over time and usually located over the right lower abdomen. Vomiting can be dangerous. The main problem is dehydration. Children can get dehydration if they persistently vomit. This can occur because they are losing too much fluid through the vomiting and diarrhea. So it is important to increase the amount of liquid in a small frequent quantity. This will help to prevent your child from dehydration. So the features suggestive of dehydration may include the following. First, if your child is not passing urine over the past 6 hours, or in a young infant, less than 5 wet diapers over 24 hours. Second, can be loss of weight. Third, dry eye, dry tongue, dry lips, or dry mouth. Fourth, which is the more severe symptoms, this may include drowsiness. Sometimes they can also have increased heart rate. So if your child is vomiting, you should keep a close eye on him or her. And if the cause of the vomiting is due to a simple gastroenteritis, then your child should still be feeling well enough to play, eat, or to be him or her usual self. In most cases, you can safely treat your child at home. The most important thing is to keep your child well hydrated by giving small amount of liquid in a frequent interval. If your baby is vomiting, you should continue with your breastfeeding or giving milk feed. And sometimes if you think that your child seems dehydrated, he or she may require extra fluid. Occasionally, you may be able to provide some oral rehydration salt to replace the water or the salt that lost through the vomiting and diarrhea. Fizzy drinks and fruit juices should be avoided until they feel better. So you should consult a doctor immediately if your child has any of the following. If the symptoms is persistent and your child is getting more unwell, or your child shows signs of dehydration. If your child has persistent vomiting and the vomitus is greenish in color, if your child is vomiting out blood, or you observe there's blood in the stool as well, persistent headache or severe abdominal pain. You should also look out for whether there's any signs of drowsiness, lethargy, which may indicate that the symptoms is much more severe. So like what I have mentioned earlier, so the major problem of vomiting is dehydration. So try to keep your child well hydrated by giving small frequent amount of liquid. This will help to prevent them from dehydration.